losing sleep? Are you getting up multiple times at night? When you urinate, does the stream come out real slow, stop and start? Take you 10 minutes to finish urinating at night? Are you missing parts of movies because you're up so many times during the movie? Have you peed on your feet yet? You don't know which way to turn? You know you need to make an appointment with a urologist, but it's not something you really want to do. Today I'm going to share with you the one treatment option for BPH or benign prostatic hyperplasia, which causes these symptoms, that actually cures the problem and has minimal side effects. I'm Dr. Frank Simoncini, sometimes I'm known as the Flow Fixer. I've been treating benign prostatic hyperplasia for over 25 years. There's supplements available all over the place. They really are not much better than a placebo when they've been tested. Many patients go through all the different supplements and none of those really help them. They finally seek care from their family physician. They might put them on a medication such as Flomax or finasteride. And those don't cure the problem. They might help the symptoms somewhat, but they have a lot of side effects as well. Flomax, for example, causes what's called floppy eye syndrome. It can affect your vision, can make you dizzy. Finasteride can cause a delay in the diagnosis of prostate cancer. It can cause suicidal depression in some cases. Everybody's heard of the one person that's had the Roto-Rooter procedure, or their great-grandfather or their uncle or somebody, and he said it was the worst thing in the world. The truth of the matter is that's called a transurethral resection of the prostate. That procedure is the gold standard treatment, surgical treatment for BPH, and it does work pretty well. The problem with that is it has a ton of side effects, such as bleeding, prolonged catheter use, prolonged irritative voiding symptoms, which I think is the worst. It causes urgency frequency for months. It can cause erectile dysfunction, can cause incontinence. It is effective, however. The good news is over the last 25 years, there have been multiple attempts at finding a less invasive procedure for BPH, and there's a ton of them have come out. TUMT, TUIP, TUNA. None of these procedures work as well as a transurethral resection of the prostate, and they all have their own specific side effects, which are pretty significant. So one day, someone thought, instead of cutting the tissue out or burning the tissue out, what if we just pulled the tissue apart? And what was known as a UroLift was created. So UroLift, we use implants that pull the tissue apart. It's almost like tying your drapes back. It creates a channel that you can urinate through, very similar to a bigger procedure such as a T or a P. But here's the good news. There's no cutting. It can be done in the office in an outpatient setting. I usually have anesthesia come in and sedate you so you don't know what we're doing. But what that relates, or what that translates to, is minimal side effects. You do get blood in the urine for a couple days. You might get some frequency of urination for a few days. Unlike medications, it cures the voiding dysfunction. So it leads to a significantly improved urinary stream with minimal side effects. It can be done in the office, in an office setting as well, period. So if you're having symptoms of BPH, you're getting up at night, you're losing sleep, you're tired during the day because of it, you're missing movies, or you're urinating on your feet, you're going to need some help. I'm very proud to announce I've been recognized as a Center of Excellence from Teleflex for excellence in UroLift procedure. My results have been significantly better than the original studies that were performed. I'm very proud of that, and I'm very proud of the Center of Excellence designation. You know if you're having symptoms from BPH or not. If you are, you're going to need some help. If you want to improve your urinary flow, sleep better at night, empty your bladder in one urination, with minimal side effects, UroLift might be the answer you're looking for. I'm filling up quick, but I do have appointments available through the end of the year. Ask for Dr. Frank Simoncini. Ask for the Flow Fixer, 480-924-7333. If you like the contents of the video, please subscribe to our channel. Like us on YouTube, like us on Facebook, like us on Instagram. Thank you.